Hi everyone, thank you for joining us for our talk today on cholesterol and triglycerides. So today we're going to discuss what cholesterol and triglycerides are, the effects of elevated cholesterol and triglyceride levels, and how to manage your cholesterol and triglyceride levels. So what are they and where do they come from? So you can see on the slide here we have some images of what cholesterol looks like and what triglycerides look like, and both of them are basically fats within the bloodstream. So if we look on the left-hand side of the screen, the function for cholesterol is it's a building block for cells and certain hormones within your body. So we do need a little bit of it to help build those cells. Where it actually comes from, which you may be surprised about, is 80% is produced in your liver and 20% comes from your diet. So what you're eating, what you're putting in. A quick and easy example of cholesterol a lot of people think of are eggs. So it's usually found in our animal byproducts, those foods that we eat. Then on the right-hand side of the slide, we see triglycerides. So their function is to provide energy. And the source of them, they come from excess calories. So for example, if you're going to eat any simple carbohydrates, so white pasta, white rice, when you eat them, your body breaks them down into triglycerides. And then when you don't need them, they get stored as fat. So your body says, hey, I'm saving it for later. So if you eat a lot of those kinds of foods, you might find you have high triglyceride levels. So we have two different types of cholesterol. Seen here, we have LDL in yellow and HDL in green. Can you guess which one is your bad and which one is your good based on this picture here, looking at the inside of an artery? All right, any guesses? So if you said LDL is the bad cholesterol, you are correct. So LDL, you can remember it as we like the L, the first letter there, low, or lousy, because this is the one we don't like. So it contributes to plaque buildup. And as you can see here in the image, we have this artery. And what happens is if the lining of the artery wall gets damaged, your body likes to heal itself. So they send some, cells to help out, and those cells can make the lining sticky, and then LDL, that bad cholesterol, can start lining up, and as you can see, it's creating a narrowing within this artery wall. And then we have HDL, which is our good cholesterol. So we like this one to be higher, and we are happy when it's higher. The reason is because it helps carry LDL back towards the liver to be recycled and removed. So as you can see in this image here, it's just another example of, so we have LDL lining that artery wall, but then we have our little HDL worker with his wheelbarrow loading up that LDL and taking it away so it can be recycled. Now we know what cholesterol and triglycerides are. Now, why do we care and why is it a risk factor for heart disease? So when our cholesterol levels or triglyceride levels are high, it can lead to plaque buildup. So as you can see here, plaque buildup, the medical term for it is atherosclerosis. So if you look to the image on the left, if you can see the one on the vessel on the furthest left of the slide, it's showing an artery where there are no blockages. So oxygen, which is carried by our red blood cells, travels freely down the artery or along it. Then the second one in, the artery is showing you that LDL again. So that yellow lining along the artery wall is creating a narrowing. So if we were to think of the 401, if they were doing construction and they blocked one lane, obviously all the cars have to move over. We still have movement. It's not that impactful, but definitely causes a little bit of an issue. Then in the third vessel here, we can see that the LDL, that plaque buildup, has gotten so intense that maybe if you want to think of the 401 again as an example, only one lane of cars is going by. So obviously we have less blood supply going by, it's not as quick, and of course when our blood vessels, when we're exercising or stressed, they can constrict or get tighter, and that can make a complete blockage, which if this was a coronary artery, so arteries that supply blood to the heart, it would be a heart attack. So I mentioned coronary arteries, but basically this can occur in any artery of your body, which we'll talk about in the next slide. And that's why we care about keeping our levels in check. Some other conditions when we have elevated cholesterol and triglyceride levels are angina. So angina, I just want to say, is not a heart attack. So if you remember from the previous slide, we saw the vessels and we saw that narrowing. So angina is if we have those vessels that have narrowing, when we're exercising or stressed, as I mentioned, those blood vessels can get tighter. And again, then we don't have a lot of oxygen or blood flow quickly passing through. So your body then sends a pain signal, especially if it's arteries of the heart, saying, hey, I'm not getting enough supply and demand here. You need to slow down the intensity here, or, alleviate it. So those patients might be on a nitro spray or use a nitro patch, and they're monitored by their physicians. I did mention in the earlier slide that we may have coronary artery disease. So again, those are just vessels that supply oxygen and blood to the heart, and we can have blockages there or narrowing. And I already mentioned that the concern for there is having a heart attack. We also have something called peripheral artery disease. So as I mentioned, this plaque buildup can happen in any artery. So in our images here on the far left, the first one on the furthest is you can see some blood vessels traveling up to a brain. So these are carotid arteries, and if we have blockages or narrowing there, it can turn into a stroke or something called a TIA, which is a transient ischemic attack. Sometimes it was in the past called a mini stroke or a small one, and those can lead to either temporary or permanent brain damage. So that's why we care about that one, because obviously your brain does need oxygen. It needs that blood supply. The second image here, you see someone grabbing a calf. That's also peripheral artery disease. So we have blood vessels that travel to your arms and legs. And if they have those blockages, we can definitely have intense pain there. So maybe those patients, when they start walking, they feel that intense pain, they have to slow down or stop, and that pain will subside because, again, it's your body telling you, I'm not getting enough supply of oxygen and blood because of that narrowing. As I mentioned, because this plaque buildup can happen in any arteries, we can have chronic kidney disease. So remember, the kidneys filter our blood, which can lead to dialysis in the future if our kidneys are impacted. And then we can have gallstones. So within your gallbladder, that helps process kind of the fats and whatnot, can develop gallstones, which in many cases, some people might need their gallbladder removed. So knowing your numbers is so important. So we always encourage patients to either know your numbers by asking your family doctor or cardiologist, your heart specialist, or keeping track of it online. If you're going to like a Life Labs or a DynaCare, and they will tell you what your numbers are. So you might have gone for blood work, and our lousy cholesterol LDL, we want less than 2 millimoles per liter. Our HDL for males, we want greater than 1 millimole per liter. And for females, we want it greater than 1.3 millimoles per liter. You might be saying to yourself, why is the male and female so different? Well, the reasoning is because of estrogen. So as females, we have estrogen, but as time goes on, estrogen declines. And as it declines, our HDL declines. So to protect ourselves, we want that number a little bit higher. And then triglycerides, a reading that's non-fasting, we want it then less than 2 millimoles per liter. But please note that your doctor may have told you a different target, and that could be based on your medical history or what they're aiming for. So again, these are just general guidelines, but important to keep track of whatever your guideline or target is and watching it over the years. So how do we best manage our cholesterol and triglyceride levels? So as I mentioned earlier, this is a risk factor for heart disease. So how do we manage it best? Any guesses what we could do first? So always a good answer in cardiac rehab is doing exercise. So doing 150 to 300 minutes of our aerobic activity, and then also doing 2 to 4 days per week of resistance training. So we want to know that exercise movement can help lower our LDL and increase our HDL. Also, we talked about what we put into our body, our fuel sources. So this is just showing a quick image of the Mediterranean diet. You can watch one of our Heart Healthy Eating talks or our Canada's Food Guide talk or Mediterranean Diet talk to learn more. But basically from this picture, we're focusing on unprocessed foods, whole grains, fruits and veggies, different types of protein. So at the bottom there, the base, that's where all of that is. Also looking at fats. So obviously we eat fats. An example here, if you can see, is an avocado. So that is an example in that bottom there as a saturated fat. We also have within that bottom pyramid some oil. It could be extra virgin olive oil, and that is considered an unsaturated fat because it's liquid at room temperature. Another example of a saturated fat that's solid at room temperature, you can think of meats and whatnot. Any kind of, thing that's solid at room temperature. But as you go up this pyramid, we're choosing more fishes. You can see less focus on eggs or dairies, looking at your milk fats there, choosing lean protein, and obviously really minimizing, maybe only once per week or none at all, our red meats or sweets, choosing water. Now I'd like to point out the red wine. I think a lot of people have heard the study about red wine and how it can help your cholesterol levels. What that really is they're looking at the red grapes, and the skin of the red grape can have some benefits and help with lowering that LDL and maybe increasing your HDL. But I always say to people, don't start drinking more or start drinking just to get this, as if you think that's going to get you that health benefit. Better to stick with just the grapes. We want to reduce or quit smoking. The reasoning is that active smoking, that combustion, so it doesn't have to be cigarettes, can damage the lining wall. And remember, we talked about plaque buildup, so that can lead to LDL increasing and your HDL actually decreasing as well. We want to stay within our alcohol guidelines. So in the couple past years, the Canadian risks for alcohol consumption kind of came out, talking about what we want to aim for. You can watch our talks on alcohol and smoking to learn more about those guidelines, but maybe sticking within those guidelines and moderate, keeping it minimal, our alcohol consumption. And then lastly, what we can do is take our prescribed medications. So these medications are called statins that help lower that LDL. You maybe have been prescribed by your family doctor or heart specialist. And these are taken at night because it's actually trying to impact the liver production of LDL, which usually is most at night. We've talked about how to best manage your cholesterol and triglyceride levels. So now let's test your knowledge. So we'll go through this together and we're going to find out which of the following statements is incorrect. So A, cholesterol is a waxy, fatty-like substance in the bloodstream. B, atherosclerosis can occur in any artery in the body. C, high HDL levels can contribute to increased risk of heart disease. D, saturated fats are solid at room temperature. What do you think? So if you thought C, you are correct. So high HDL levels can help decrease the risk of heart disease, not increase it. Remember, HDL helps take away that LDL to be recycled back to the liver. The other ones are correct because cholesterol is a waxy, fatty-like substance in the blood. We talked about that on the very first slides. Atherosclerosis is that medical term for plaque buildup, and it can occur in any artery of the body. And then lastly, when we were talking about the Mediterranean diet, I gave some examples of saturated fats, so those are solid at room temperature.